Good afternoon, ladies and gentlemen. My name is Brittany Tubbs, and I'm here to speak to you today about a very important issue. Mental health and substance abuse are two very big issues that desperately need to be addressed. They are widespread and need much intervention. Studies state that on average, those who are chronically homeless and have substance abuse issues die 25 years sooner than those in the average population. Also, almost 1 in 5 American adults experience a diagnosable mental health condition per year. In 2015, more than 12 million Americans reported misusing opioid pain relievers, and nearly 1 million Americans reported using heroin. In addition, more than half of all Americans know someone in recovery from a substance use problem. This is why the Mental Health Parity and Addiction Equity Act needs to be implemented and utilized across all states. This issue is one that affects the entire population. The 2010 Global Burden of Disease study concluded that mental illnesses contribute to a lifetime of disability, as much or more than cardiovascular disease and cancer. Because of this, it's necessary to integrate mental health prevention, treatment, and programming into public health programs. Please keep in mind that just because an insurance plan offers mental health coverage, it doesn't mean that it's actually good coverage. Also, mental health plans do not have to follow federal parity, federal parity include Medicare, except for Medicare's cost sharing for outpatient mental health services as they comply. Medicaid fee-for-service plans also do not have to. Grandfathered individual or group health plans that were created and purchased before March 23, 2010, and plans who received an exemption based on increased costs related to the parity. Although such regulations are in place, there are still some states that are not in compliance with mental health parity. If a state has a stronger state parity law, then health insurance plans in that state must follow those laws. Federal parity replaces state law only in cases where the state law prevents the application of federal parity requirements. Federal parity also applies to clinical criteria used by health insurers to approve or deny mental health or substance use treatment. Determinations must be made such as if the treatment or supplies used are medically necessary. However, what are the requirements to be medically necessary, and who makes such determinations? What is mental health parity? According to NAMI, mental health parity is the equal treatment of mental health conditions and substance abuse disorders. When an insurance plan has parity, it means, like with any health condition, it must offer an unlimited amount of visits. The APHA is striving to improve access to mental health care and put it at the same level as mental health. With the Affordable Care Act, it expanded coverage to include mental health, those with pre-existing conditions, making it illegal to deny such coverage. The APHA states that in order to achieve true health parity for mental health coverage, policymakers at both state and federal levels must do the following. First, enact comprehensive parity laws in all states. 2 states that are implementing this new policy are New York and California. What they have done is prosecuted insurance agencies who are not in compliance. Second, support stricter enforcement, transparency requirements, and implementation. Third, push states to have a definition of medical necessity, and that puts a priority on clinical practice and uses the behavioral treatment model, making it more standard across the board. Fourth, fund, train, and provide mental health parity navigators to detect parity violations and work with insurance companies to bring their plans into compliance. Currently, there's an agency called the Task Force, which has been set in place to ensure that Americans are receiving their benefits from the mental health and substance use disorder parity protections. However, and again, New York and California are the only two notable states that are enforcing penalizations. We need to be sure that the task force is actually setting out to do what it was designed for. Number 5, fund and invest in research relating to evidence-based practices surrounding parity implementation and parity policy standards for insurance companies. 6, provide incentives for those entering and working in the mental health field. Currently, many mental health care providers aren't accepting insurance as they aren't being paid in the same manner as your typical healthcare provider. Revisions to pay need to be made so that mental health providers will accept insurance, and more who are in need will be seen due to not having to pay as much out of pocket. Why? Because they now are covered. What community members and consumers should do? They should be educated about mental health parity and their state laws surrounding parity requirements. People should know their rights. It should be explained to them by their insurance agencies, and this just isn't happening. Public health agencies, what they should do. First, put programs and policies in place that surround education of parity, insurance plans, and mental health. Make it all inclusive. Second, encourage public health professionals to be well-versed in mental health and substance abuse care and how important the issue is, such as what we're doing here today. This should be a national effort. SAMHSA is announcing that it will host 2 state policy academies on parity implementation for state officials in the fiscal year of 2017, including one focused on commercial market and one on the parity in Medicaid and the Children's Health Insurance Program, also known as CHIP. These academies will bring together national experts to provide technical assistance to teams of state officials on strategies to advance parity compliance and lessons learned from other states and their implementations on their efforts. Why? The previously released final regulations of the MHPAEA only apply to commercial market and do not include Medicaid and CHIP. The MHPAEA doesn't require insurance plans to offer coverage for mental illness or substance use disorders in general. It also doesn't require for plans to offer coverage for specific treatments or services for mental and/or substance use disorders. Former President Obama created a $1 billion proposal to fight the opioid epidemic and enacts mental health reforms which are focused on serious mental illness, suicide prevention, and mental health parity protection. According to the National Institute on Drug Abuse, the disease of addiction alone costs $700 billion annually in treatment, crime, and lost productivity. Deaths from heroin overdoses alone jumped 5-fold between 2001 and 2013. Think about how much could be saved if the Mental Health Parity and Addiction Equity Act was mandated and implemented throughout all states. Now, you may ask yourselves, what are the risks of implementing such a policy? What are the risks of not implementing it? Well, the risk. With typical health coverage, many go to see their physicians when perhaps they don't need to. This may end up increasing the cost of healthcare. However, do keep in mind that $700 billion was spent due to mental health and substance abuse issues in 1 year, and that's a trend that's happening annually. Physicians who are not providing fee-for-service care may end up working more hours and being paid the same. However, those providing mental health services may begin accepting insurance as they'll adequately be paid. This will cause an overall reduction in the money spent for those who weren't able to be seen for treatment, because preventative measures will be in place to help them with their significant issues prior to a major occurrence. Legislators may not be in favor of this act. However, once it's implemented, they will see that all the great that it produces. By voting for states to have mandating states to have and enforce the Mental Health Parity and Addiction Equity Act, the nation as a whole will reap great benefits. Lost wages will go down and production will go up. More mental health professionals will be willing to accept insurance. The quality of people's lives will increase as they are not being hindered from receiving vital services, all due to inadequate coverage. I thank you for your time and willingness to help make this change that will only benefit our nation.